So welcome. Today with us we have got Dr. Mozaffarian, who is the Dean of Tufts School of Nutrition, and we are very fortunate that he'll be joining us at the annual conference as the keynote speaker. Dari, welcome.
Thank you.
So when people talk about Worksite wellness in general, the first thing that comes to their mind is step challenge. I took so many steps last week, I took so many steps yesterday. Nutrition is usually a forgotten child. With your research and your background, how do you suggest we can bring nutrition to the forefront? And number one, number two, make it more easy for people to understand so that it gets a lot more adopted at a national level.
Well, I think, first, I think everyone realizes that food and nutrition is crucially important, but I think the two big problems is they don't realize how important it is, and then they get scared away by the complexity, and they say it's too complicated, I can't touch this. So, in terms of how important it is, we've shown that poor eating, what we eat, is the number one cause of poor health in the United States and globally. So if you want to have a Worksite wellness program, nutrition should absolutely be the top priority. This is the number one cause of so many chronic diseases, from heart disease to stroke to diabetes to obesity to many cancers. And so, omitting nutrition or only having a cursory attention to nutrition is a huge mistake. The second issue then is the complexity. So how do you address nutrition, right? Physical activity is fairly straightforward. The more you do, the better. You can track it by monitoring, does a person go to a gym? Are they wearing a step counter? And so it's relatively straightforward. The more, better. Nutrition is complicated. Should I be eating high fat or low fat, paleo or Atkins? Should I be eating local or organic or GMO? What about coconut oil? What about the cost of all these foods? Like, how am I going to afford this? Aren't healthier foods so much more expensive? So it really makes people frightened in terms of implementing this into a program. But I think what we've learned over the last really 20 years through advances in nutrition science, advances in behavior change science, and now complementary advances in technology, we can kind of put all that together and create user-friendly applications that promote healthier eating. And healthier eating is really not that complicated. It's about eating more of some foods that are healthy, and that's very positive. Eat more foods that give rise to life: fruits, vegetables, nuts, seeds, beans. All of those are foods that sprout plant life. Those are the components of those foods that give rise to life are what's vitally important for our own bodies as we age. And then eat less of just a handful of things, particularly starch and sugars, which is a big part of the food supply, soda, processed meats, highly packaged and processed foods. So eat more of a handful of good foods, eat less of some bad foods. And I think that what is needed is to implement that in a user-friendly way that has trusted, credible science behind it, that has easy ways for consumers to look at and understand what's a healthier choice, and then hopefully has clear incentives for making the healthier choices, whether it's financial incentives or other gamification incentives, competitions. All of those things have been shown very clearly to work.
Excellent, thank you. So that means at the annual conference, you'll be talking about some of these ideas that the employers can take back to the respective workplaces and implement nutrition programs as well. So if any one of you is watching this video and would love to know more about nutrition and how it can help your own family, your own life, as well as your employees' life, you have a reason to see us at the conference and hear Dr. Dariush's session, so you can take away some key learning for your own population. Thank you. Thank you.